One of the most traumatic situations a woman faces is when she has recurrent miscarriages or what they call a bad obstetric history. She has either repeated miscarriages in the first 3 months or later pregnancy losses or even repeated intrauterine fetal deaths. This problem is sometimes very complex, hard to diagnose and even more difficult to treat. When a woman comes to us with a bad obstetric history, the first thing we do is basic investigations, which may include her hormone studies, a sonography, as well as certain specialized tests for immunological problems such as anticardiolipin antibody, lupus anticoagulant, etc. Very rarely are some infection tests such as rubella and toxoplasmosis also done. These tests give us an idea as to what might be the problem. In patients where the baby has been born abnormal in the past, or again with patients with multiple early first trimester losses, a karyotyping or a genetic testing of the couple is often necessary. Following this, most patients undergo a hysteroscopy. This is important to find if there's any defect inside the uterus which is preventing the pregnancy from growing. Many times the woman has a septum inside the uterus. This is a birth defect which is showing the uterus to be divided into two by something like a curtain within the uterus. This septum is very easily treated by hysteroscopic surgery, where a telescope and a camera is put inside the womb from within the vagina. There are no cuts and stitches. Once the uterine cavity is visualized, this septum can easily be cut with special instruments such as either a current, cautery or a Versa point or even a laser. Following a removal of a septum, the patient very often has a pregnancy nicely going to term and delivering. Also, if there are intrauterine adhesions, which means that the inside of the uterus is damaged or stuck up because of some infection, these can be cleared too with hysteroscopic surgery. Fibroids in the inner side of the uterine cavity, the submucous fibroids, can be removed by resectoscopy similarly during a hysteroscopic procedure, and removal of these fibroids and polyps also gives excellent results in terms of preventing recurrent miscarriages. Once the patient becomes pregnant or even before that, it's very important to have the patient on basic folic acid support. Some hormonal support is required, especially during the first 3 months. In certain cases, immunological problems, we need to give drugs such as aspirin or even low molecular weight heparin, etc. All these really help in reducing the problems of recurrent miscarriage. This pregnancy obviously has to be very closely monitored because it's a high-risk pregnancy. Sometimes a lady is facing pregnancy losses in the 4th or the 5th month. These are usually due to an incompetent cervix or a weak cervix. And these women do very well if a cervical stitch is taken in the 4th month of pregnancy. This is a small procedure, hardly takes 15 minutes, and a purse string stitch is placed on the mouth of the womb. This prevents the cervix from opening out spontaneously and helps the woman carry the pregnancy till the 9th month. So depending on the particular problem, specific treatments, investigations and therapies are chosen, and many women with repeated pregnancy losses are able to go ahead and deliver a healthy, normal child at 9 months.